Now, India's mission booster begins today. We're bringing you all the very latest on that front under the third leg of India's vaccination drive. Health and frontline workers along with comorbids about the age of 60 will be jabbed. At least 2.6 crore frontline workers and 6 crore comorbids above the age of 60 will receive the third dose. The comorbids can take booster dose after doctor's advice. The booster dose will be the same as the earlier doses. Most importantly, it is not mandatory to register on the CoWIN portal. Those eligible can directly take an appointment or walk into any vaccination center. The booster campaign assumes significance as the country is now witnessing a massive surge in COVID infections.
The booster dose drive in the state of Tamil Nadu has been initiated by the Chief Minister, and we have the Health Secretary. Thank you so much for speaking to us, sir. So, how many people have been identified to be eligible for the booster dose in the state?
See, the healthcare workers roughly around 5.68 lakh and 65 lakhs, 9.78 lakh frontline workers, and roughly around 20 lakh of the 1.04 crore elderly population. Of course, subject to their having taken the dose for the healthcare workers and the frontline workers, most of them have time eligibility is there. With regard to elders, we are looking at their time eligibility and allowing them. So that's around 20 lakhs. So roughly it is 29 plus 5 around 35 lakhs.
60 वर्ष से ऊपर की आयु के कोमॉर्बिडिटी वाले नागरिकों को उनके डॉक्टर की सलाह पर वैक्सीन की प्रिकॉशन डोज का विकल्प उनके लिए उपलब्ध होगा। ये भी 10 जनवरी से प्रारंभ होगा।
Finally, the much-awaited moment is here. India starts vaccinating its eligible population with the precautionary dose, popularly known as the booster dose, 10th of January onwards. Healthcare workers, frontline workers, and those above the age of 60 with comorbidities are eligible. Appointments for the third vaccine shot earlier opened on CoWIN. This is the online appointment facility. There is no need for new registration for those taking the precautionary dose of COVID-19 vaccine. The government has even said that those who do not want to take an appointment online can do a walk-in. There is no need for a comorbidity certificate to be produced before the third dose. Those who are taking an appointment or walking in must know that their wait for the third dose might just get longer if 9 months have not lapsed since you got your second dose. Also, if you're infected right now, then you have to wait for 3 months for your precautionary dose. Well, if you've had an infection recently, then again, you have to wait for 3 months since the day you turned negative. The government has also said that the third dose will be of the same vaccine given in the past to the recipient. Mixing of doses is not allowed.
The precautionary vaccine dose that will be given to healthcare workers, frontline workers and individuals 60 years and above with comorbidities will be the same vaccine as has been given to them previously.
Government sources say that there have been concerns about severe reactions in mixing doses, a risk they could not afford to take. Experts, however, say that this is not the best way forward and that using a third type of a vaccine for the precautionary dose should have been ideal.
There is a group of people who hold divergent view. They think that booster should be of different vaccine because it may elicit more immune response and protect you more. However, more research and more data are available. Till that time, please follow the government's diktat and immediately go for boosters.
The only outcome measures we have now are based on mRNA vaccines, which also have the ability to boost the antibody levels 28-fold, which is a lot more than inactivated virus vaccines as well as adenovirus vector vaccines.
Bharat Biotech, the makers of Covaxin, however, say the indigenous vaccine will offer long-term protection as a booster dose as per a study done by Bharat Biotech and the Indian Council of Medical Research. India, meanwhile, is seeing an exponential surge in COVID cases, courtesy the fifth variant of concern. As healthcare system feel the pinch because of the surge, the need to protect the vulnerable is non-negotiable. In New Delhi, Sneha Moldani for India Today.
Taking this across to our battery of reporters, Milan Sharma from Delhi, Prema Rajaram from Kolkata, Rickson Oman live from Thiruvananthapuram. Let's begin with our health reporter, Milan Sharma. Milan, any issues as far as supply chain for these booster shots is concerned? What are you picking up at the moment, pan-India?
Well, Chaiti, it was informed to a lot of centres where the precautionary dose is being given today that there should not be any shortage or last moment chaos when it comes to giving a booster dose. I'm at RML and this is a centre where Covaxin is being administered as the third precautionary dose, and you can see that there is a line of people who are waiting outside as well as inside. Currently vaccinations are happening for both, remember, those above the age of 18 years, those from the age of 15 to 18 years, as well as the 60 plus comorbids with healthcare workers and frontline workers. But remember, a lot of healthcare workers have tested positive. That seems to be a worrying sign because they will not be eligible to take this third precautionary dose at the moment. They have to wait 3 months to recover. And as I said, 1.03 crore healthcare workers have taken the first dose. The second dose has been taken by 97 lakh healthcare workers. Definitely the vaccination stock is being kept according to the slots that are being booked in the vaccine centers. Here we have been informed that 50% seats are allocated to those who want to walk in. So in case they are not able to register, they can come and walk in, register over here and go straight inside to get their third precautionary jab. These kind of steps have been taken so that people can feel comfortable coming into centers to get their vaccine, even as we're looking at the surge in cases across the country. And that is possible because right now all precautions are being taken by the healthcare and the frontline workers who are themselves also getting vaccinated in many hospitals across India, even in vaccination centers. Especially if we talk about Delhi government, the vaccination centers have now been shifted to many Delhi government schools where vaccination is being given. But at the central government level, RML and other hospitals are also holding the vaccination drive for all those frontliners and healthcare workers who are eligible today.
Thank you very much, Milan, for that all-encompassing ground report right there. We'll keep coming back to you for more on this and questions arising on why are journalists also not included in the frontline workers. You see the battery of reporters right there that we're bringing to you. They're risking their lives and bringing you all these stories so that you stay updated. Now, questions arising on how to get booster shot. Number one, beneficiaries can use their existing CoWIN account, which means that you don't have to create another separate CoWIN account for this. Number two, new CoWIN registration not required. Again, you cannot be going again and again to CoWIN to make your registration, so use your old CoWIN account, that is fine. Number three, can find out your due date on www.cowin.gov.in. Due date in the sense from the last vaccine dose that you have taken, which is your second dose, to now, which is your booster. The gap and everything will be, the details will be available, and it will throw in suggestions as to when you are eligible or not. Number four, book appointments online or through walk-in mode. So either go online, book your appointments, or just walk in to any of the centers if you think you are eligible, and they will just cross-check your CoWIN details and get you jabbed. Number five, 60 plus do not need to submit any certificate from doctor. So you don't need a doctor's certificate if you are above the age of 60. Just go get yourself jabbed if you're eligible. Let's go to Rickson, who's now joining us from Kerala for the latest details. Rickson, any kind of impediments that you're finding on ground where, because today is day one of India getting the booster jabs at the moment? Any supply chain issues, any vaccine naysayers, hesitancy? What are you picking up at the moment?
Well, Chaiti, a big positive response from the side of people to the booster dose vaccination drive. Right now, I'm here in General Hospital in the state capital. The vaccination drive was started at 9 o'clock in the morning. We can see big queues in front of the hospitals for this booster vaccination drive. We can clearly say that, it will be a big relief for the state because, yesterday it was reported 6,238 cases in the last 24 hours. So it's a big spike in the number of COVID cases in the last last 2 months. The CM has also called for an emergency COVID will be meeting at 11:30 on this spike. So we are hoping that the state government will implement more restrictions in the coming hours too. Right now we can see, the procedures are progressing here. The vaccination drive is progressing here. A good response from the side of people regarding this. So we have a health worker joining here with us. We can take a reaction on that. So how you feel, ma'am? How are you reacting to this booster?
I am a health worker, specifically a dental specialist, and I feel our profession is at very high risk. But irrespective of that, what we have come to know about the vaccines, the efficacy of a vaccine lasts maximum of 6 to 9 months, and this booster dose is a mandatory thing, irrespective of your profession, your age. So I think everybody should take it, and you can call yourself completely vaccinated only if you have the booster dose also taken.
So what do you think it will help to reduce the number of cases?
No. I don't think it will bring down the number of cases, but it will definitely reduce our hospitalization, the chances of the disease getting very serious, and I think if you just get it like a common cold or a flu, it is okay. But if it affects our important organs and you need to get hospitalized, then that is a difficult thing. So if this can avoid that, definitely a big boon.
So what do you want to tell others who are having comorbidities?
Definitely get the vaccination at the earliest possible. Do not delay.
Well. So get the vaccination as soon as possible. People reacting positively to this vaccination drive, and also government is also planning to conduct several awareness programs in the state which related to this booster vaccination drive. Chaiti.
Absolutely. Rickson getting us those details right there. Prema Rajaram also joining us from Kolkata. Prema, the biggest issue in Kolkata is that most people have not even got their second dose, leave alone the booster jab. How is the government ensuring that they step up to even take their second dose in the first place?
The biggest challenge here is to get the population, which is 40% of the population, to take the second dose of the vaccine. They'll have to wait for 9 months before taking the precautionary jab. So that is something that the government is appealing to the people to come out, take the second dose of the vaccine. And for other senior citizens who are eligible to take the precautionary dose, to come out and take that dose. We have a doctor here with us. You've just taken your precautionary jab. What was it like? Did you have any hassles? Did you have to register before?
No, I just came to and walk in into. I showed the certificate.
And what is your message to others who are wanting?
All my patients to come and go and take the vaccine.
Go and take the vaccine is his message. I'm going to ask those over here who are part of this private clinic, if you can tell us what is the measure for those who want to come and take the vaccine. Do they have to register before?
Not required. They can walk in over here. We have got the provisions. We have the team. We have the technical know-how also. We'll help you register and jab it as soon as possible.
How many patients have come in, or rather how many people have come in to take the precautionary jab?
Around 40 to 50 people have walked in since morning to take this booster dose, and out of 50 people, I think so around 30 to 34 has been vaccinated, and the rest were not very much sure about the time gap which was required from the second jab.
So people are still to get more information as to when they are eligible to take the precautionary dose of this vaccine. But the good news is many people coming inquiring to take that precautionary jab. Back to you, Chetty.